Hi everyone, it's Randa with RadExam here. Today we have an excellent neuro case for you guys, so let's go ahead and get started. In this case, we have a 32-year-old female presenting with progressive bilateral lower extremity numbness. An MRI of the brain was performed. Based on the representative image, what would be the most likely diagnosis? Could this be multiple sclerosis, hypertension, diabetes, or CADASIL? If you would like, go ahead and take a moment here to pause the video and come up with an answer, and then we can go over it. For this case, the answer is A, multiple sclerosis. We are provided with a single axial flare sequence of the brain, which demonstrates multiple flare hyperintense lesions that are predominantly periventricular in location. Given the age of the patient and presenting clinical history, the overall picture is classic for demyelinating process and multiple sclerosis. Another very classic look for multiple sclerosis can be seen on the sagittal flare sequences. These lesions are seen to extend outward from the ventricles and corpus callosum. These are termed Dawson's fingers. When evaluating cases of demyelination, it is important to be sure to scrutinize the DWI and ADC sequences, as well as the post-contrast sequences for findings of active demyelination. Active demyelination will present as incomplete ring enhancement or restricted diffusion. CADASIL can also produce flare hyperintense signal changes. However, these tend to have a predilection for the temporal lobes, as seen in the example shown here. CADASIL is an autosomal dominant disease process due to a mutation on the Notch3 gene. It often presents in a slightly older age range, somewhere between 30 and 50. Hypertension and diabetes can result in chronic microvascular ischemic changes, which give a similar MRI appearance. However, the extensive degree of lesions in this patient is unlikely to be solely due to chronic microvascular ischemic change, especially given the young age of the patient. Remember, though many answers could possibly be on the differential, you should always pick the best answer choice of the ones provided. Thanks for joining us today. Be sure to check back soon for another RadExam learning case.